Hi, Mike. I know we talked a lot before, uh, so I'm just gonna go straight into it. So, first of all, congrats on your newborn,
Thank
and
you.
and tell us what's new in like what's new right now.
In life in general, I guess,
Yeah, yeah.
obviously just had my first kid, so that's been definitely an adjustment, but it's been, exciting and everything that comes with new parent life. So, trying to figure all that out. It's definitely been time consuming and consuming the mental processes, but, we're finding a good routine of things. So that'd
Nice, nice,
probably be the biggest newest thing for me. So, how about
nice.
you?
I got a G League position,
Nice, excellent.
and yep, enjoying life, enjoying life.
Very good.
So, apparently, like the reason I want to have you on, because uh, I like the way you break down movement. I like the way you explain biomechanics. So, feel like in the past, like few years, no matter it's basketball, um, football,
Hmm.
there's maybe I'm wrong, but I think there's actually more and more soft tissue injury whatsoever, hamstring, groin.
Sure.
So, this is a huge topic, but like with all these sport technology, you're gonna hit me. But force plate,
Hmm.
Norboard,
Yeah.
force frame for adductor squeeze.
Yeah. Yeah. Yeah.
Why do you think we still have all those, like, or maybe even more?
Yeah. Um, I mean, I think along with some of those technologies, they're kind of started to become like an overly simplified view of the utility of some of those things, and then also like what you need to train with some of those things. I think when all this force plate stuff and the force decks and et cetera started to come into view, a lot of it was just broken down as more is better in terms of overall force production. And in the realm of soft tissue injuries and tendon injuries and muscle injuries, that's not always entirely the case, right? Like sometimes it is that straightforward in terms of, okay, we just need to increase peak force outputs or something like that. And then, we'll improve tissue resilience or whatever the buzzword is that people tend to throw around. And like I said, sometimes that's the case, and sometimes the tissue needs more force deliverance. But a lot of other times that's not really the case, and it might need the exact opposite, or that might not be the issue in of itself anyway, right? There might be some sort of way in which the direction of forces entering the tissue is also kind of the issue, right?
Hmm.
We're trying to, with a lot of these things, I think a lot of topics in general, it's like we're trying to take this kind of complicated situation that's multifactorial and multivariable and break it down to one thing to help simplify it for us. And then anytime that happens, you you kind of start messing with stuff that you don't know what exactly is going to happen. And it can either potentially solve the issue or it creates a whole host of other issues that, you know, again, I'm not going to sit here and be armchair quarterback of like everyone's that's doing all these overcoming ISOs is causing issues. Like I said, like it can solve the problem potentially, but could also potentially lead to other issues. So
Hmm.
yeah.
So, one thing I do want to ask you, one thing I want to like maybe dive a little bit deeper is like, I think nowadays, not just like, I think people tend to, this is what people tend to do. Coaches, strength coaches, athletic trainer, physical therapist, this is what they tend to do. Oh, knee pain, let's focus on the knee.
Sure.
Hamstring pain, hamstring's weak.
Sure.
Groin pain, adductor's weak.
Sure.
Low back pain, all right, mow the low back,
Yeah.
right? Uh, and you kind of talk about like sometimes it's not. I think you mentioned I forgot how you mentioned, but like you say, sometimes it's how the force transfer to that area. If that
Yeah,
ma- if that makes, can you
for sure.
like explain more about that?
Yeah, absolutely. So with tendons, most, let's just say collagen in particular, which essentially every tissue in our body has some sort of collagen in it, right? Um, but we'll highlight tendons since that gets the most publicity. Um, Tendons tend to like tensile force. They're really good with tensile forces, but they're terrible with shear and with compressive forces. Okay. Now, a force is a force. When we start giving it different names like torque force or shear force or compressive force or tensile force, really the differentiator is how, the direction in which that force is applied to that tissue, right? Because I can certainly, stream a vector, a force vector through a tendon, and it's perfectly parallel to its collagen fibers. Great, I have a tensile force. Well, what happens if I skew that vector, you know, 15 degrees, 20 degrees, 25 degrees to the horizontal? All right, now it's not perfectly tensile. There's actually a little bit of shear force or torque force, depending on if we're able to actually harness it and create some sort of like rotational element to it, right? So when we're talking about the direction of that applied force, that's essentially what we're describing. And it's interesting because like we know this, we're well aware that shear forces don't agree with tendons. And again, like all we're talking about is just direction of applied forces. So if the angle of a cut is a little bit different, or even if the attachments of that tendon are a little bit different compared to how the um, force is entering that site. So the position of the foot at the time that force is entering, the position of the knee at that time that the force is entering, that'll essentially change the direction of loading and therefore change the type of force that would be being imparted on that tissue, right? And, there's degradation that can potentially come from that for all the soft tissue injuries based on that direction of loading, right? So that's
So
kind of what I'm
yeah.
talking about.
So let's dive a little bit deeper into this.
Sure.
So uh does that mean like having relative motion in joints could help for
It it's a potential buffer. Yeah. Now again, what we're always trying to find is optimum, right? Because we could have someone that has so much relative motion that it's too much of a buffer or too much of a dampener, and then the tendon really isn't harnessing any of the elastic energy whatsoever. It just simply isn't stiff enough to start to absorb some of that stuff. Um, and then vice versa, we can have someone with no relative motion. In that case, the direction of loading essentially has to be perfect every time, which never happens, right? So with relative motion, we essentially have a little bit more capability to deal with forces or tolerate forces or harness forces that aren't necessarily moving in exactly the right direction that that tendon needs at that point in time, right? There's almost a little bit of play or wiggle room or a reduction of the constraints on that tendon that enables that tendon to kind of deal with some of those changes of direction of that load a little bit more effectively.
Hmm.
Um, that would effectively be the utility of relative motion in something like reducing the likelihood of an injury, right?
So let's say like because I mainly deal with athletic population.
Hmm.
So and like as you know, like probably most of the athlete out there, like high level athlete out there, they probably a lot of time they're at like uh their late propulsive phase. So they're relatively stiff. Does that mean like bring them back to like mid stance or like bring them back to mid stance or early propulsive will potentially prevent or like potentially like reduce a lot of injury risk?
So we're gonna let's take a step back. So we'll not necessarily define the terms, but at least understand like some of the components to it, right? So with something like late propulsion, you're probably looking at a foot that doesn't necessarily dorsiflex as well, and a shin and a tibia that is likely going to be a little bit more externally rotated compared to internally rotated. And we'll look at an Achilles tendon in that example. Okay. In that particular instance, you're also likely going to have a slightly stiffer Achilles tendon to where it's not going to be able to deform as much compared to someone that can dorsiflex a little bit more and can internally rotate their tibia a little bit more. Okay. Now, with that particular situation, again, you have to look at the context in terms of does more deformation enable this person to deal with some of the forces a little bit more effectively versus not dealing with them more effectively, right? So let's take this late propulsive situation, okay? Uh, Depending on the amount of energy that that tendon needs to absorb, that's directly correlated to the amount of deformation that that tendon can go through. So if I have a stiffer tendon, it is not going to be able to deform as effectively compared to one that is a little bit less stiff. So it's able to actually absorb more of that energy, right? Now, I think part of the misconception is that, oh, okay, if we just build stiffer tendons, it's going to be able to withstand more forces, right? And that's not really the point of a tendon. The point of a tendon is to be able to absorb more of the forces. Now, it also has to release that energy as well, right? So that's where the actual stiffness comes into play. Okay. Um, so now if I'm training someone and there's some sort of an indicator that we're not actually able to absorb enough of that energy, or these particular movement strategies, like a late propulsive phase, so that increased plantar flexion, ER tibia, is resulting in direction of loads that are more shear in nature and not enabling us to even deform enough to absorb some of that energy, okay, then yes, it makes sense for us to start to bring their center of gravity back, change or start to enhance some different shapes or biomechanics at that foot and that tibia in order to essentially enable them to do both of those things. So deform a little bit more and enable the biomechanics to capture more of that force vector to enable that deformation. Okay. So that so if that's the situation, then yes, we could totally train more of that stuff
Well, what are like some other situations?
that we would want to
Uh,
train some of that stuff. Are we talking specifically for the Achilles or
no, like oh, probably like overall groin or hamstring.
sure. So uh for something like a hamstring, and we're just looking at like sprinting capabilities, um, it this will depend again a little bit more on the specifics of the position, the biomechanics of the hip and pelvis itself, right? So if we take someone that has a little bit more of an anterior orientation at their pelvis, maybe that changes the mechanics of the hamstring and the mechanics of their running form so that they might be a little bit more what we would call like a backside dominant running form. Okay. So we're not actually able to harness as much of the elastic energy through frontside mechanics and swing phase at the hamstring, and then we're not able to create more of that elastic recoil at the hamstring itself. So then maybe we're looking at something more like a muscle strain that's trying to overcome the lack of elastic action, right? Maybe the length tension relationship of that musculature is a little bit more eccentrically oriented, and then we're also looking at something like a muscular strain in that circumstance, right? Um, Now, if we also take someone where that proximal attachment on the hamstring, so the ischium, to where the shape of their pelvis is a little bit more externally rotated, so the ischium is starting to move a little bit more towards the tailbone, then this might even be a circumstance where uh, that direction of loading starts to be modified a little bit. So maybe we're actually looking at more torsion actions or torsion forces moving across that hamstring as a result of that positioning as well, right? So again, those would be two circumstances for something like a hamstring. And you could even look at the same kind of dynamics as an adductor as well, right? Especially as it's starting to, excuse me, transition and bring the leg into a little bit more extension. You're going to get, I mean, if you even look at the structure of like a ham of an adductor in general, it kind of looks like a spiral staircase, like working its way up from the that medial epicondyle all the way up into the pelvis. So it naturally is structured to enable and capture some of those rotational forces as you're going into hip extension. But if you're modifying the position of the pelvis or the shape of the pelvis in such a way that it's not enabling that to happen, okay, we might have issues that arise from that, right?
So, all right. So let's say if an athlete, his pelvis, forgot what it's called, is anterior-oriented,
Hmm.
and then he had a hamstring strain.
Hmm.
So his hamstring is eccentric oriented, right? And then
Hmm.
he test like that's probably why like if you test his hamstring's weak.
Potentially one factor on the Norboard, you're saying?
Yeah. So what
Yeah.
happened if we keep doing Nordic hamstring exercise?
So, all right. So this brings up another great point to where, um, again, I think in general, us as practitioners, both on the S&C side and on the medical side, need to be very particular about some of the terms that we use, or at least have an understanding of the underpinnings of those terms. So when people talk about something isn't strong enough, I tend to have an issue with that word of strong or strength, right? Because in effect, what we're describing is force production. But there's many components of force production that have nothing to do with, what people are insinuating when they say, oh, this thing isn't strong enough. Because a lot of times the insinuation is, okay, we just need to directly load this tissue to increase hypertrophy or increase motor unit recruitment or speed of recruitment in order to make this thing stronger. And that would be a component of force production. And maybe this individual would benefit from some of that, right? I'm not saying that those are not useful adaptations. But when people talk about strength and then they perform an intervention, 90% of the time, what I observe are interventions that are working on exactly that. It's hypertrophy and motor unit recruitment, right? Whereas plenty of times there's a positional component to what we're seeing on that Nord board, whether it's an asymmetry or a reduction in their baseline testing or a reduction from what normative values would be for that population, there can be a positional influence that we can alter relatively quickly to essentially just like rule out if it is an influence as well as how much of an influence it is, right? So let's say there's a I don't know, a 20% difference in asymmetry on hamstring strength on the Nord board, right? Well, we got to figure out why that asymmetry exists. And then if there is some sort of biomechanical or positional component to that, what exactly that is, what's causing it, And then if we undo that, do the hamstrings measure differently, right? So this is where some of our table tests come into play of like, all right, if I can also correlate, hip internal or external rotation or hip extension right to left with those Nordic values, and I see that there is also an asymmetry in those other values in terms of the table tests. Okay, let me do interventions to modify those or rectify those asymmetries. And then do we also see an improvement in the Nord board, right? So we're kind of working backwards, but we can't really look at some of these values in a vacuum, right? Like there's all these other multifactorial issues that come into play when we're investigating some of these things, right? And I think that's where like a lot of the siloing in pro sports comes into play because, at the same time, if like the medical side is trying to intervene on some of these um, table test asymmetries, but then at the same time, S&C is trying to intervene on the hamstring force production asymmetries, and there's no communication back and forth in terms of exactly what's causing some of those things. And if they are potentially correlated, then we have two opposing views that are not necessarily working with each other where they, in effect, should be, right?
Hmm.
Ideally, we'd be doing activities to rectify the movement asymmetry at the same time we're also doing activities to rectify the force production asymmetry at the same time, right? So there's plenty of ways that, maybe there is a lack of force production coming from that hamstring musculature, but there is also a positional component to it. Can I train both of those things at the same time? And maybe that's also part of the reason why, or part of the solution for this particular athlete, right? So,
What if like sometimes, because I remember listening to like what Bill Hartman say, like sometimes table testing get messy. Like if you do a lot of soft tissue on it, like it's all sometimes you can't really like understand where it is.
trust the table test?
Yeah,
Sure.
yeah.
No, absolutely. And that's even part of, as when I'm a practitioner, when I'm deciding interventions, I also keep that in the back of my mind, right? So maybe in like that first session I have with someone, all right, I see the movement asymmetry and then I just kind of attack it hands on with some soft tissue work. And okay, we get a modification in that movement asymmetry. Great, awesome. Pat myself on the back. I did my job, all that stuff. But then they come in a week later and they're still suffering with the same issue, right? Okay, so now my decision tree changes in terms of the interventions that I'm going to potentially select, right? So do I want to continue to do the soft tissue stuff, or do I want to potentially work on, let's say, utilizing a hamstring to improve pelvic position, even though previously I was doing soft tissue modification to improve that same position, right? Is that more likely to be the intervention that leads to a better outcome? And like those are decisions that, I'm trying to figure out and make all the time, right? Because there's plenty of times where just altering the position of the bony structures was enough and did the trick, and that's great. There's other times where it wasn't as effective as I wanted it to be, and now I got to figure out plan B, plan C, plan D, right? And that's you got to mess around and find out with some of that stuff. I don't think there's going to be exactly like a perfect algorithm or a cookbook to tell you exactly what those answers are. A lot of times it's just a matter of intervening and then just seeing what happens, and that's what's actually going to tell you the answer, right?
Hmm. So, another topic related to like pro sport or injury is at Major League Baseball. already have a lot of like the biomechanics lab.
Hmm.
Um, NBA start to like implement it. I think hockey are starting to try to implement it, right? Even American football are trying to implement it. Do you
Yeah.
have like experience with like those motion capture or like uh biomechanics software?
Yeah, for sure. Mostly in like the baseball space, since that's the sport that I kind of predominantly work within, but I'm at least aware that other sports are trying to implement more of that in different ways, right?
So obviously like data processing is easier on baseball end because like you're not gonna move around. You just stay at the same mound and like pitch for like whatever.
For
But
sure.
outside of that, in your experience, like we talk a lot about foot and ankle. We talk about SI joint, how the pelvis move, pelvis shape,
Mhm.
right? Right. There's
Mhm.
like narrow ISA, wide ISA, what or pelvis anterior oriented, posterior oriented.
Mhm.
Um, I guess my question is like. My personal experience is like most of the biomechanics software can't capture that. So how do you make decision based on that?
Yeah, and again, I think that's why really it just comes down to like philosophies on assessment and evaluation, right? We're getting really good at measuring and finding all these different variables, but no one tool is ever going to actually measure every single variable that is at play, right? And so I think of it as layering your evidence, right? So if I do some sort of motion capture data, deal with some sort of Nordic hamstring data, deal with some sort of table testing data, what I essentially need to find is the cohesive narrative or the story behind all of these values that are going to lead me to a solution towards the problem that I'm trying to solve with this person, right? And some of this technology might be beneficial for that particular situation. Some of the technology might be noise, and it's not the most useful data that we've ever had, right? I guess that's the nice part about pro sports is that there's plenty of money going around to uh, spend on potential noise. But maybe it's useful for a particular situation, and so then we can justify the expense of it, right? I really don't have anything against force decks or Nord boards or adductor squeezers or mocap data or anything like that, because really that's like me being mad at like a ruler or like a tape measure or something like that, right? It's like, okay, you can measure something with a ruler. You could also measure something with a tape measure, but understand that you're measuring distance in inches as long as you actually understand what exactly it is that you're measuring and what you can do with it, right? I think that's really more of the issue with some of the technology is like having a clear understanding of what exactly it is that we're measuring. And then that can lead to issues in terms of what are we actually going to do with this stuff, as opposed to, oh, all this technology is just wasteful and not useful in of itself. Just because I've solved plenty of issues with force plates, and they were actually extremely useful in that circumstance, right? So yeah, and that just goes back to like our prior conversations about, not having that myopic view of what this technology is doing for us, right? Not just blatant blanket statements of like all force production, more force production is better, more pelvic rotational velocity is better, more thoracic rotational velocity is better, more this is better, right? We're in the business of optimizing with pro guys and even high school and college guys to some extent too. So
Yeah, 100% agree with that. I remember talking to Vernon Beta and said like he basically said like force plate measure is super expensive body weight scale. I'm like, yeah, that is kind of true.
I
Because
mean, technically, yes.
yeah, because let's talk about this a little bit. Uh,
Sure.
because you're not like I don't know about you, but like if you ask me, I'm not gonna make any change just based on the force weight metric. Just being honest, like if there's if there's limb asymmetry, like it might be caused because like uh might because of patellar tendon pain, might because of like patellar femoral pain, might because of like SI joint or something like I mentioned, one side is more anterior rotated, one side is more posterior rotated, one side, or maybe even scoliosis, like we talked about before.
Yeah,
So I'm
number.
not gonna, for me, I'm just not gonna change it,
Sure.
right? What about you?
I mean, yeah, again, like you can't look at it in the vacuum of again just making that blanket statement of oh this limb asymmetry and their counter movement jump at their peak braking forces is like so terrible, right? Again, like these measurement devices don't intrinsically hold value to these numbers. These numbers are just numbers. It's us as humans that are bringing our values and projecting them onto these numbers, right? So like an example I always think about is like let's say egg sales in America are like skyrocketing, right? Egg sales in America are up 20% just because, I don't know, new data came out that eggs are great, right? That metric is just a metric, right? That metric to a egg farm or a chicken farmer is fantastic. He's thrilled about that number. That metric to someone who sells oatmeal is pissed because that means less people are probably going to buy oatmeal, right? So it's the same exact number, it's the same exact metric, but two people from two different perspectives are going to look at that metric and have very different um, emotional reactions to that same value, right? It's the same thing for kind of like what you were describing with the force plate stuff, right? Just because there's an asymmetry, like we kind of need to look at it with a little bit of an unbiased opinion until we have more information about the context of it, right? So let's say we go and do a force plate jump test, and someone's coming back from an ACL rehab, and coach wants him out on the floor next week, but there's a 30% asymmetric difference side to side. It's like, okay, that's a little bit of a different scenario, right? Than potentially, you know, a separate circumstance, right? So again, like as soon as we start to paint the context of the situation that we're in, and I'm the responsible practitioner for that individual coming back from ACL rehab, and that's the number, that's the metric. Okay, maybe I care a whole lot less about this, right? But maybe if I'm looking at this and it's off of a high jumper who really only jumps off 1 foot for a living, I don't know, do I really care about that as much? And they're injury free, right? So again, like two very different contexts that, we should have different responses to, right?
Yeah, I do want to talk a little bit more about this because um talk about the maybe a basketball player he want to like return to play from an ACL and look at his force play number. So uh I think a year ago when I was still at Louisville, we went to do a study on like 10 D1 Power 5 school, all basketball players, like, and a lot of them are actually, some of them are actually in the NBA right now, but whatsoever. So what's funny is, what's really interesting is, I think we got like 120 to 150 athletes, right? And if you look at the metrics, even the force time curve or force velocity curve,
Mhm.
some of the athlete that tore his ACL
Hmm.
or Achilles tendon, they actually show perfect on force plate, perfect symmetry,
Yeah.
right? On counter movement jump or even drop jump.
Yeah.
But what and like there are some athletes that if you look at the curve or metrics, they have over like 20-30% asymmetry and they're perfectly healthy.
Yeah, that's fine.
So so uh and another part about this is like I remember when I was at Louisville, I got an athlete like returned to play. He got really bad patella tendon pain and
Mhm.
force plate short is perfect, but it just can't. If you look how he move on the court, he just can't decelerate off of that leg. So talk to me about that. Like what would you do about like those type of cases?
If they can't, if they cannot decelerate
Yeah,
onto that.
can't not.
So again, like, there's a few things to this, right? The Everything that potentially goes into limb symmetry or limb asymmetry on a force plate is extremely multifactorial, right? So kind of like, what your buddy described a force plate as is just like a really fancy weighted scale. Like that is in effect what it is, right? It's just measuring the weight of gravity on that surface at that point in time. Now, there's everything that's happening above it that it's not potentially measuring. So there could actually be an asymmetry in their movement profile that in and of effect starts to even everything out down below it. But maybe one part of their body was delivering force a little bit more onto the left side versus another part of their body is delivering a little bit more force onto the right side, right? So I'll put that as a caveat, right? There can also be like totally symmetric actions, but maybe the force time curve is telling us something a little bit more dramatic comparatively, right? So if someone has like an extremely tight force time curve where it's like just a really high impulse really, really quickly, that's great for someone who's able to capture and deliver forces in that particular direction of force delivery, right? Might also be an indication that that tendon might not be able to deform as effectively because of the amount of tension placed on it. So maybe for certain individuals, especially those that struggle with a little bit of deceleration, maybe we want to widen that out a little bit more. Not to the extent where we're harming their jump metrics, but if it's someone that has like a really tight curve and their depth of drop isn't all that great, but yeah, it still results in like a really high jump and really high braking forces. But then does that necessarily transfer over to how effectively they can run a 5-10-5 or play defense or get into like a defensive stance or, change levels, that kind of thing, right? So, like I said, there's all these other layers of evidence that also start to become extremely relevant that, just peak braking forces isn't going to be our KPI for every single thing that we're potentially looking at, right? I don't know if
Mm.
that totally answered your question or if I was kind
Yeah,
of going
yeah,
a
yeah, of course, of
little bit of
course.
a tangent. I guess, other ways that I'm looking at um, issues with deceleration, again, is this person in a position or some sort of pelvic position where both the direction of load is sending force in a particular direction that is like outside of their base of support, or at least not within the capacity for them to withstand or hold too much of that energy? Is there too much energy going into some of these structures too quickly based on some of that positioning, or even just based on the physiology of that tissue, right? So it's hard for me to totally peg down exactly what I would do with them just because, those are all questions that kind of come to my mind and initially with that circumstance. But, like I said, it wouldn't just all come down to limb symmetry, right?
Yeah. I'm sorry putting you in the spot to answer those like
No, you're fine. No, it's good. I think people will at least appreciate like, you know, I'm not gonna be able to give them like a straight like this is what you do for if they got 15% of limb difference, blah blah blah, right? But at least like, I think part of it is just like understanding like, all right, what questions do I need to kind of ask? Where, what other rocks do I kind of need to flip over to investigate a little bit more, right? Because I don't know, you're this is like part of the issue with like literature in and of itself is like you're probably going to find literature that deems asymmetry to be extremely relevant. You're probably going to find literature that deems asymmetry to be not so relevant, right? Mostly because with our studies, we're trying to boil down all these multifactorial issues into a single variable that we want to measure. And then we're shocked that it's not giving us a clean demonstration of what exactly we're supposed to do. It's kind of like we're kind of complicated and multifactorial or something like that. That's so weird to think about, you know?
Yeah,
So,
especially like I remember I think last week or something I was reading an article, research article
mhm.
about like force plate being using only force plate counter movement jump as a dictate of neuromuscular fatigue and injury prediction. I'm
Yeah. Yeah.
you're not gonna get I'm like you're not gonna get anything out of that. Like
R-
you can't use force plate to dictate are they able to like get patella tendon pain or Achilles tendon pain? No way.
Right. Yeah. It could be, is neuromuscular fatigue a reason why it's lower? Sure. But there's also potentially 20 other reasons why that it's lower. You know what I mean? So that's again, that's the tricky part with the everyone wants that myopic, simplified A equals
Yeah.
B equals C demonstration. And, I don't know when, but I'm hoping that everyone can come to terms with the fact that this stuff is harder than it seems, right? So.
So, all right, go. I want to go back to hamstring, right? So let's say a football player
Hmm.
had a hamstring
Right.
strain, right? What are what are your assessment process? What would you be looking at first, and then the second?
Honestly, I would want footage. Like, do we have footage of the actual event? Because then that also starts to give me a little bit more context of it, right? Was it a wide receiver running a flag route or like a deep post route? Was it a running back kind of running out of the flat and he's going to make like a very longitudinal cut, right? Because again, then that already starts to give me context to start to understand the rest of my assessment, right? And so now if I'm in a state-of-the-art NFL facility, I'm probably going to utilize all of the tools at my disposal, right? I probably will look at past counter movement jumps. Was there a trend? Were they tracking stuff fairly consistently on a week or a bi-monthly basis or whatever it was? Was there changes in that trend? Where is he right now? Same thing with like a Nord board, and then same thing with table tests and table measures, because then that gives me a little bit of like a biomechanical assessment of where they're at, right? And so now, if I've got, let's say a NFL running back who was trying to cut off of his left foot, and he's like coming out of an accelerative cut on that left side, and that's when he hurt his hamstring. And then I look at his left leg, and he's got, I don't know, -5 degrees of hip IR. On the Nord board, there's a 25% difference in force production. And then he's also putting the majority of his weight into his counter movement jump on the right side, even prior to some of the injury that ended up happening. Okay, my interventions might look a particular way based on all of that whole assessment, right? Versus I've got a wide receiver who pulled it after running a 60-yard go route, and I throw him on the table, and he's got like -60 degrees of uh, hip extension. He's got like a 45-degree straight leg raise. The depth on his counter movement jump has slowly been decreasing. And then I don't know. Well, no, they probably wouldn't have that kind of metric. So again, like those are all different circumstances in terms of how I'm actually going to intervene on that, right? Maybe on his counter movement jump, he was showing more of like that double peak action at like his braking phase or something like that. Again, those are all potential useful variables that are telling me a little bit of a different story on this guy, right? So,
Cool. Cool. I
yep,
love this. I love this. All right. So, another thing, I feel like maybe I'm wrong, but I feel like a lot of times when we talk about injury, it doesn't matter like what type of injury. Somehow there's the athlete. That's just my experience. Somehow those athletes show like either very limited IR in their hip or like no, just negative IR.
sure. Yeah, I mean, I
Do
wouldn't be.
yeah, do you think that's like would you think that that's like a like I don't know. That's a huge part of the reason that a lot of injury is happening right now?
It is a potential factor, right? So let's think about if we're gonna see actions of internal rotation, not necessarily just at the hip, but throughout the entire body, right? So anything where I'm going to move a part of my body down and in towards the ground, that would be internal rotation. So that would be some mechanism for delivering force into the ground, right? In terms of degrees of freedom, the hip is in a really good position to maximize the amount of internal rotation that may be able to be present, right? So when we're talking about like direction of loading, and we look at like fibers of the glute and the hip internal rotators and all of like the that like staircase structure of an adductor group, even how like a quad kind of wraps around the trochanter, like all of that tissue structure musculature is developed to have a very wide berth of force delivery as well as force acceptance, right? The directions of force that the hip can both accept as well as deliver are much more widespread compared to something like a knee. Okay. But if I don't have the capacity to demonstrate all those directions of loading at that particular joint, but I'm still delivering the same amount of force via a internal rotation movement. Maybe it's happening a little bit more at my knee. So maybe I'm having more of like a medial joint capsule at the knee starting to expand in order to enable that medial epicondyle to start to come down and in. So more of like that hyperextension motion, right? Maybe I'm delivering more of that force through the ball of my foot or my big toe, right? Maybe I'm doing it through a lumbar spine where I'm starting to create a little bit more side bend and orientation of the pelvis through actions of the lumbar spine, right? Based on the specialization of the anatomy of that hip, if I don't have that internal rotation present, then I'm probably going to have to demonstrate it elsewhere if I'm going to continue to demonstrate the same amount of forces, right? I think that's what people talk about when they say like high level athletes are really good compensators, right? Really all we're saying is they're finding a way to get the job done despite some of the constraints that are on their system, right? So their force production hasn't gone down at all. Their movement speed in terms of like top end speed or agility hasn't gone down at all. But they're using very different affordances based on the constraints that are on their body, right? So now it starts to paint a different picture in terms of what are some of these acute loads, where are they occurring, what are the direction of those acute loads, right? Starts to be somewhat relevant. So yeah, if we have a massive constraint on an athlete who's trying to deliver force and they have a -5 degrees on their total arc of motion at the hip for internal rotation, like yeah, that's kind of an impediment that I'm not helping them produce force at that structure that is kind of meant to do that, right? So.
Hmm. All right. Last question before I let you go. So, like you said, like all those places to compensate, right? Recently, I posted on Instagram, like I feel like this is just my personal experience. A lot of lower limb injury happen because either they have SI joint dysfunction, pelvis oblique, like one side is more posterior oriented, the other side is more anterior oriented, or they
Mhm.
have some sort of like they lack of mobility around their foot and ankle.
Okay,
And if you like fix those places, a lot of times you can get athlete back faster.
sure.
So what I received, like one of the message I got is like, so how do I dictate which one go first? Which ones go like how do I fix like do I fix the pelvis first? Do I fix the foot first? I want to ask your opinion about this. Although
Mhm.
I although I think we kind of talk about kind of same concept before, but still.
Yeah, there's I think there's two concepts that I kind of use to help guide this kind of answer in terms of like what's the driver, right? What's the thing, what's the variable that's eating up the most amount of influence in this situation, right? Um, the first concept is kind of what we were talking about before, where it's essentially like, are you familiar with Schrodinger's cat?
Yeah.
Like the idea in
Yeah.
physics, right? So we don't really know if the cat's dead or alive until we actually look and see if it's actually dead or alive, right? So it's kind of the same answer at the end of the day between, the two branches of our decision tree. Like, do I, at this point in time, both the pelvis and the foot could be a factor, right? The cat could be alive or dead. Well, I'm not going to know if the foot or the pelvis is a huge factor until I actually intervene on the foot and the pelvis and then remeasure my KPI or my situation to actually understand how much of an influence it's actually being imparted on this entire picture, right? So let's say we care about hip internal rotation as our KPI, and we have some sort of like oblique orientation at the pelvis, or we have some sort of shape at the foot that would be counterproductive for that motion, right? Okay, I'm gonna intervene at the pelvis, and then I'm gonna recheck. If that was at -5, but now it went to 10, all right, great. I know that it took up that chunk of the variance, right? Let's say I try and do the same thing for the foot, and it went from -5 to 20. Okay, there's my answer right there in terms of the foot was taking up more of the variance than the pelvic position, right? The other piece that I would also say, just as kind of like a guiding light in terms of like which one should I really pick first, right? So let's say I think through experience, I have some sort of like normative range of what a quote unquote normal or average foot would look like. And then there's standard deviations away from that norm or that average, right? And then same thing for hip and pelvic position, and then there's standard deviations away from that average. If one particular variable is two standard deviations away versus one particular variable is only one standard deviation away, it's probably a good idea to intervene on the one that's two standard deviations because it's probably eating up more of your variance and having more of an influence on the system at large, right? So that's kind of how I think about it in terms of like, all right, what's standing out to me the most about this person's presentation? Like what's really, different or what makes them them? What's part of their quote unquote superpower, right? And then that helps me kind of dial in my perception of them or what I'm trying to work on at least for them. So with that,
Nice. Nice. I love that. I love that.
yep.
So that's basically the last question I have for you today. So for those who are interested in what we're talking about today, where can they find you and where can they find your Substack?
So our Substack is context driven Substack. So it essentially is meant to explore more of these same questions of like we're not just going to look at stuff in a vacuum, but at least what is the context of the situation and how is that influencing decision making. So we have that on our Substack. You can find that on my Instagram as well. So that's Campo underscore DPT. And a link to that will be in the bio as well. But you can always reach out to me on Instagram and feel free to have a chat and ask some questions. It's always open for good conversation.
Nice.